Mhm. Yeah, that's a very good question. So, as a chief medical officer for the American Hospital, the American Hospital is a huge tertiary center. We have more than now 300 physicians and more than 600 nurses. So, how you secure that the care that delivered on all the area is having the same quality? So you do that by having a strong clinical governance department that set up the policy and procedure that's fit the standard of GCI, the Joint Commission, and fit the international standard. And you follow and you educate your team from all levels, including from the PR, which is the agent that received the patient, to the physicians, to the OR. And then you audit your team from time to time, periodically, depend on the critical area. For example, if it is an ER or an ICU or an OR, then you need to audit it more often because those are in a high risk area. If it is an outpatient, you may go a little bit slowly, but you need to audit it regularly. Then you compare those auditing results with the standard. As long as you meet the standard, you're good. If you are not meeting the standard, then you need to have a task force that to fix the standard, either identify what we call it a cause analysis, cause-based analysis, to make sure that you know where is the cause root analysis, to make sure that you know where is the problem, what's the issues, and how we fix the problem. To identify that problem, for example, if we have a problem with the care, the quality of levels in one of the clinic, and the cause is one of the nurses or one of the PR or even a physician, then we identify that. We identify the problem. We try to help that physician or that team member by educating him, following him, giving him the support, and we follow again with the auditing and result. So it is a process goes head to head with the clinical governance department. This is the key. So if in any, I always bring my hospital here. We are a private hospital, but the key for any success, regardless if it is financially or non-financially, is the quality of care. And your quality of care is depend mainly on the quality of your team. And that's including physician and non-physician. If you come to the physician, the high quality physicians that you will bring, he will be spreading a positive vibe, positive culture. He will be improve your quality. He will make you more exposed to patients. He will attract more patients, which automatically it will translate to financial benefit. But at the same time, quality is very important. New physician and new blood is really important in your institute, and you need to give them the opportunity. You cannot leave them on the shelf for 2-3 years, then you remember them. You need to give them the opportunity from day one to see if they have one of them, maybe they have a big potential to be a leader. Then you can invest in that leader and you can teach him, and even you can educate him how he will be the leader in the near future. I will tell you one in the wave 1 and one in the wave 2. For wave 1, the American Hospital is a campus that have 3 buildings. So the first decision I take is to separate the COVID from non-COVID patient. Make sure that the safety of our non-COVID patients, mainly in the American Hospital, because we have a significant oncology patient. So we separate that building, have its own lab, own team, medical team, own everything. The issues is with the wave 1, then with the missing of the policy from the DHA in terms of quarantine, the number of the patient that admitted, it was high. And it is much, much higher than the capacity of 80 beds in that building. American Hospital is part of bigger corporations. It's called the Mullah Corporation, which part of it is the hospitality. They own many hotels. So I put a proposal to take one of the Mullah hotels, which is in Holiday Inn, and we switch it to a field hospital within actually 48 hours. And we received more than 300 patients in that, and our physicians was having a station there, 24 hours presence of consultant, nurses, x-ray portable. And I slept in that hospital almost for 6 weeks just to give them the support as an administration more than as a physician. And it did save the hospital. Many hospitals ended by shutting down during this time. But because we separated our COVID patients, we ended by having the critical patient here in the ICU. They have a separate ICU. Our ER, when they identify any COVID patient, automatically puts it in the ambulance and take it to the hotel. Our non-COVID patients feel secure by having their treatment in a non-COVID hospital. And that's all save all the hospitals. And on top of that, save my physician, because I have a high number, as I say, physician. And because I open a new institute, they have something to do. So they save their salaries, job, everything else. So that's one move that we did from the CMO team. The second one is with wave 2, it was less strong in terms of the number of patients, but we ended by one day to shut down the half of the ER and building a partition to increase the capacity of the ER. And if we don't do that, our ER will be shut down and we split it into two. So sometimes you need to take a drastic action to make sure your critical departments stay alive. I need help for that with myself. How I say it, work will never finish. You need to have a control, I call it control environment. You need to sit down and identify what's your priority. Is it your personal life, your family, your work? And each one of them have a certain priority that you need to give, and that equal to time. So if you see you're having more family time, that means you will have less work time. If you see you have more work time, you're here for building career and everything, that means it will take time from your family and from your personal life. Having said that, you need to be flexible also in a time like COVID or a time of disaster or pandemic. You need to have this priority flexible to make sure that you can cover that area without stress on any one of the sections. Personally, I'll be honest with you, I have been burned out many times, mainly in the last year and a half with COVID. We slept in this hospital or in the hotel for 2-3 months. Sometimes I didn't see my family for a week or so because of the COVID. But now I was working 6 days a week, 6 to 8 every day. But now I actually, after a year and a half, I just came back from Florida for 2 weeks. That's a fresh break. And during the flight back, I decided that now we go back. After 6 o'clock, I will not have any work. After 8 o'clock, I need to drop my kids to the family, to the school and come here. And only 5 days a week, no more 6 days. And you know, I have 2 boys, so every Saturday morning, usually I take them for a boy club. We go 6 o'clock, 7 o'clock in the morning to eat in one place, you know, and believe me, you will hear the weird stuff. I have 11 years and 12 years. You hear some stuff, you feel like you've never been a kid before. And I have my daughter, so that's her separate dad kind of, daughter kind of time. So you need to have that time to be organized. Let's talk about vaccine, then special for general and then for special. For general, everybody needs to be vaccinated, period. And at the beginning, whatever vaccine you get. You told me, Dr. Dufan, you're biased. We don't know the side effect. I don't know the side effect long term, but I can tell you, I did see people pass away because of COVID. And that is worse than having a pain in the shoulder or fever or something like this. As I said, I have 3 kids and my wife, we all vaccinated except the little guy. So the little guy, he didn't get vaccinated because he was 11. So we ended going to Florida and Orlando. 3 of us, I came back and we stayed there. So the first one, he got the COVID. It was the little guy, and he was miserable for 2 to 3 weeks because he was not vaccinated. The other 3, my wife and the other 2 boys, they got COVID. But believe me, it was like a flu-like illness. They don't even feel it. So this is very important for general public. You need to get the COVID. And for special, Oh yes, there is even a study supporting that the COVID, the mortality in a COVID in oncology population is higher with the COVID scenarios. So vaccinate as long as you're not immune compromised, you're not taking any systemic treatments. Is actually now the DHA, Dubai Health Authority, just approve us to be giving the booster, which is the third dose of the Pfizer, for those special one, which specifically for the immune compromised, as long as they get out of there. So vaccine is the way. COVID will never go away. COVID will be like this, my opinion. COVID will be like a flu illness. Every year we need to take the vaccine for the flu and a vaccine for COVID. And every year you will have the A and a B and a C for the flu. And you have the Delta, Binda, Dinda, all those names for the COVID. Exactly the same. I start with, I was in Canada for the beginning, and I was planning, I did my UCMLE stuff, and then I was planning to go to US. And unfortunately with 9/11, they shut down, because I am originally from Libya, they shut down the border. So I ended by working as a general practitioner, emergency physician. I passed the Canadian exam, and I stayed there for 1 year working as an emergency physician. And it was a good life. Good life, what I mean by a good money, good financially. And one day I was having a tough night at 3 or 4 o'clock in the morning. I say, can I do this job when I was 45 or 55 years old? So the answer was no, in my opinion. So that's the decision to change the career. Why I say that? You need to think about what you want in your life and what's the career that you will enjoy it even when you are 40, 50s. And you need to think also what's the market need. It's not any more surgery and medicine. No, now it's different. You need to think about what's the market need. Unfortunately, it's a market for physicians too. Well, the market need, for example, in US now, they need more radiation oncologists. They need more oncologists, medical oncologists. They need more interventional radiologists. They need more. There is another specialty, it's a very hot subject, urology also. So what that mean? That mean if I like surgery, I like to be surgeon, I don't need to be a general surgeon. I can be urologist. I can be something, I can do procedure. When that's guarantee me that I will get a job that's a hot subject, I will live in the city that I like, because work is not only work, where you live. Like now in Dubai, when you get your specialty and in Dubai, that is translate to a good quality of life. And that's to keep you going. So career is not only what dad and mom and what your family and friend or what your uncle was, what you want and where you want it to be in the future. That's career. The second component, you think about what you're passionate about. If you don't like blood, if you don't like cutting, stay away from surgery. But that's make it like when you take a decision, you will say, okay, do I like to be in the operating room and cutting and stitching people? If the answer is no, that eliminates half of the medicine. If the answer is yes, then you explore that, eliminate the other side. You need to be focused where you want to be. And you need to be focused. You need to be target oriented. You cannot have everything in one plate. You need to be specialized and sub-specialized, because this is where is the world going. I think all of us as physicians and even other specialty than IT, okay, which is the networking, the electronic, everything, IT. Everybody else, he feel threatened by the IT team. Why? Because they can jeopardize our work. The reality not. Having a strong digital team with you, it will enhance your career. It will enhance your success. It will, how I say it, for example, now with the AI coming. AI is here and it will stay and it will grow with us. Artificial intelligence is the future. It will not replace physician, it will not replace technician, but it will be a supplementer and also supporter and make us more efficient. Instead of reading an X-ray in a 5 minutes, you will read it in 1 minute. You have a double reading between you and the computer. So digitalizations for our life is coming and it's growing and it is the future. If we don't adapt, I'm from the old school, by the way. I remember those books. So if you don't adapt, you will stay behind. So you need to adapt. And that's another one for all our, there is a student, adapt. Sometimes you go to a new country, there is new rules, there is a new culture. You need to adapt. If you don't adapt, you will not survive and you will not succeed. I will be a businessman. My dad, I came from a bigger family, all of them business, except me. I usually work as a businessman in my summertime. My dad passed away, but he was a big businessman in Libya. So in the summer, he usually give me one of his store as a rental, and I will take care of it, just to make an income instead of going and playing around, But to be honest, the business is in my blood, and I think this is one of the things helped me to be the CMO back in administration back in US and here now for the 4th year. Is actually the business thinking. You can understand your operation team what they are talking about because it is a business. Unfortunately, any hospital you need to survive, but business is good. Business, you have risk, but you need to calculate it. So I'll be a businessman, nothing else. No police, no flying guys. I know pilot stuff. No, just business.